This video will teach you the OMM technique known as Clavi-Pectoral stretching. Now, one thing that's important before I get started is that you should only do this technique after the thoracic inlet has been addressed, which is something we'll talk about in a later video. Now, the purpose of Clavi-Pectoral stretch is to increase the venous and lymphatic return from the head. And this is good for any disease or any condition that causes edema of the head or neck, like tonsillitis or pharyngitis, anything like that, this technique will help with. What you want to do is have your patient just be relaxed. And you want to find the AC, or acromioclavicular joint, of the shoulder. It's going to be right here. You find the acromion, and just anterior and a little bit inferior to that, it's going to be that AC joint. This is right near, or just superior to where the humerus, the head of the humerus, comes up and sticks into that joint, glenohumeral joint. And you want to take the thenar eminence, which is basically your thumb, the base of your thumb, I should say, and place them right on those AC joints. Now what you want to do is you want to push down into the table and a little bit towards the patient's feet, so posterior and inferior on the patient. You want to push down and in, and you want to hold that with about 10 pounds of force, so not too much, but a firm force there on both sides for about 20 seconds. Sometimes it helps if you're shorter or if you're having problems coming up with that force to stand up, because that way you can have gravity help you, so I'll show you that now. You really just want to push forward. You don't want to hurt the patient. Sometimes you need to readjust your hand grip. This technique can also help with anterior or rounded shoulders, but it's usually used to try and help drain that edema from the head, that venous and lymphatic return from the head and neck. And you have to do that for about 20 seconds. The patient's head may clear up. They may start feeling some drainage, some relief of that congestion. But it's a technique you may have to do a couple different times or over the course of a few days. And that is the Clavi-Pectoral stretch.